Assisted suicide ushers in abuse, discrimination, and injustice. Rather than hastening patients' deaths, we should advocate for increased access to mental health, palliative care, and hospice services.
The Catholic Conference of Illinois calling out the atrocities of assisted suicide legislation making its way through the state. There are, in fact, two bills, Senate Bill 9 and House Bill 1328, which are identical. They allow a patient with a terminal disease who is expected to die within 6 months to ask for a physician to prescribe medication to end their life. The patient must ask for the deadly medication orally and in written form, and re-request the desire to die within 5 days of the initial request. They must also have the mental capability to make an informed decision. Both the Illinois Senate bill and House bill have been assigned to executive committees for review. Bob Gilligan, the executive director of the Catholic Conference of Illinois, joins us now to talk further about how the church is responding. Bob, it's such a pleasure to have you here with us.
Thank you. Good to be here.
Great. Bob, what is the Catholic Church in Illinois doing to fight these concerning bills on the legislative front?
We're doing a lot. We've organized that press conference that you just showed a couple minutes ago. We've been working with a coalition of disability rights groups, doctors, nurses, pro-life groups, et cetera, to coalesce and lobby the members of the legislature. We've been walking the halls here in Springfield for the last couple weeks. Just recently, we've also placed some targeted ads in certain districts to try to gin up, more phone calls and more awareness at the issue. And just recently, actually, it was just on Friday, the bishops, there's 6 dioceses in the state of Illinois. Each bishop is going to release a letter, and it's going to go to the pastors, and they're going to urge their pastors to put this letter in bulletins to do 2 things: to make the Catholic laity more aware of this issue, and also ask them to call, write, and talk to their lawmaker, urge them to vote no. Each letter will be a little different, each catered to the individual style of the 6 bishops in Illinois. So those are going out soon. I've seen 3 of them. I think there's 3 more to go. So hopefully those will appear in churches all over Illinois this Sunday and next Sunday.
Is it harder to combat these bills because there are 2 of them?
No, it's the same. This is one of those issues where assisted suicide says it all. It's not something necessarily tied to the bill per se. It's the topic. People know about this issue. They've heard about it, but it's also surprising to us, like how much more education is needed about the dangers of the law on assisted suicide. And people have a general awareness, but I think they need to know further about the dangers of the law.
And I think it's great that you're having the bishops write these letters. Have you tried that before, and what was the impact?
Yeah, we do on selected topics. We don't do it all the time, obviously. You can only do it when something rises to a significant level of importance. But we have. We did it a couple of years ago in Illinois, like many other states. And unfortunately, we're talking about those so-called reproductive health care acts, those kind of things. The bishops did it then. And we have good response. We have a pretty good response. Obviously, every pastor calls the shots in terms of what happens in their parish, but many of them do it. Some will actually talk about it from the pulpit, which is very helpful. We encourage that, but we know that that's not going to happen in every parish. So we have pretty good response.
That's great. And can you talk about the resources the church offers that allow people to choose life?
Yeah, what we try to do is encourage in this conversation is, we don't want to be put in the position of just saying no, just saying no all the time. And what we try to explain to lawmakers is that there's an option here. The option is, fortunately, and we're blessed to live in this time, in this era in 2025, where we have things such as palliative care and hospice care. And these can be tremendous resources to people that are experiencing pain or suffering, either at the end of life or during any time. It's more of a holistic approach to addressing what truly is happening in a person's life. That is a far better path forward than, here, take these pills to end your life. That's really not what we're trying to present, a better alternative to people through palliative care and hospice care.
Well, Bob, thank you so much for the work that you're doing. It's very important and much needed.
Yes, thank you very much. And once again, if anybody can go to our website, www.ilcatholic.org. There's a whole packet of material there. It explains the issue. There's a question and answer. There's a letter from the bishops. There's novenas. There's a prayer series that we're recommending. Just about anything on educating yourself if you're interested, and also how to take action.
Great. Thank you, Bob.
Thank you.